The head of the Menzies School of Indigenous Health Research is stepping down after 6 years at the helm. Under his leadership, Dr. Johnatahn Carapetis has boosted research funding at Menzies by $20 million. But he's now leaving to take up a job at the Telethon Institute for Child Health Research in Perth. I spoke to Johnatahn Carapetis earlier about his time with Menzies. Dr. Johnatahn Carapetis, welcome to the program.
Thank you.
You first came to the Territory almost 20 years ago. Do you think you've made a difference here?
Gee, I'd like to think I've made a difference, but I don't think you can overstate the impact of one person. But, you know, I've been involved in research that's very much at the pointy end, trying to kind of make a difference today and tomorrow rather than in 20 years' time. And I've managed to keep that going over a very long period in 2 stints in the Territory. So I think my research has led to things that I think have made a difference. And of course, as the director of Menzies, I'd like to think that that has had an influence on the institution and on the Territory as a whole, I guess.
Menzies does a great deal of research in showing the gaps in Indigenous health. Is it disappointing to see so little improvement in the area overall?
I think what's happened in the last few years has its positives, has its negatives. But there's no doubt that the fact that this country is paying serious attention to Aboriginal wellbeing, that there are now major resources flowing into it, dollars that have the right numbers of zeros behind them, I think is a good thing. We can't expect things to change quickly, and I think that's the other positive that's happened over the last few years, is we've kind of done away with the search for quick fixes. We know where this is going to take a generation or 2 or more. We have to set in place the infrastructure, we have to set in place the systems so that things can change over time.
Your research in the 90s led to the establishment of Australia's first rheumatic heart disease control program in the top end. What difference has that made here in the Territory?
Look, the rheumatic heart disease work is clearly one of my passions, and what we've seen is firstly that the research has been integral in getting new approaches to controlling the disease, which, as you say, is started with the Northern Territory, but it's now gone national. So we now have a national rheumatic fever strategy, and I'm quite proud of that. That means that the Commonwealth Government is funding control strategies and programs in the Northern Territory, Queensland and Western Australia, and a national coordination unit, which in fact is hosted out of Menzies. That all is adding up to things that are changing. So we are now starting to see that the rates of what we call recurrent acute rheumatic fever, the rates of compliance with treatment are improving. And so I think we are now seeing things that have been on the worst, the graph in terms of rheumatic heart disease has been climbing and it's plateauing, and I think we're in the next few years going to see it falling.
How acceptable is it that we even have rheumatic heart disease in our community here?
Oh, it's a national shame. This is a disease that is a disease of poverty, of disadvantage, and it's a disease that almost doesn't exist in any wealthy, affluent community. The rest of Australia has no idea that we have amongst the highest rates in the world in the Aboriginal population in remote settings. So that's something that we should be ashamed of, but it's also something that has motivated governments and certainly health service staff to do something about it. We can't afford, though, to just rely on the medical solutions. We can't just rely on a control program. We have to remember that at its root, rheumatic fever is caused by poverty, by overcrowded housing, by poor access to medical care. So we have to keep an eye on the main game, which is changing those basic living conditions in order to get rid of this disease in the end, which should be our ultimate aim.
Do you think politicians take enough note of research that is done in terms of their policy direction?
No, is the short answer, and that's a bit of a hobby horse of mine. I think a lot of the interventions that have been implemented around closing the gap are not necessarily based on the best evidence about what works and what doesn't, and perhaps even more important, we haven't set in place well enough the mechanisms for measuring and monitoring whether they're making a difference. And the risk there is that after a few years, it might be a great idea, whatever the intervention is. If you haven't measured it properly, if you can't measure whether or not it's made a difference, then you don't know whether to continue it, whether to change it, whether to ditch it and come up with something else. And that's what's been the history of Aboriginal affairs, if you like, for 30 years, and we just have to stop doing it that way. We're changing a bit, but I want us to go further.
What would you say you're most proud of during your time here at Menzies?
I'm most proud of the fact that we've taken Menzies from an institution that was fantastic, that had established itself very much on the Northern Territory landscape. We've taken it that next step to make it an institution that's now if you like, a national icon that has established itself as the leader, I think, in Aboriginal health research and a significant player in global and tropical health research, but that has also driven itself according to the important health needs of the population. So I think I've set up Menzies, or helped to set up Menzies, and you've got to make it clear here, it's the people of Menzies that have made the difference. I've just kind of been the steering wheel, that we've set it up to continue to do great things for the future.
Dr. Johnatahn Carapetis, thanks so much for joining us.
Thank you.